Good evening, everyone. Welcome to LUMP Pet Acupuncture Orientation. And we are very fortunate with us, a very successful acupuncturist from the US. To introduce him, let's welcome the Vice President of LUMP Foundation, our moderator for tonight, Dr. Ryan Baldomero. Good evening, Dr. Ryan. Can you please unmute your mic?
Thank you. Good evening, everyone, and thank you, Dr. Hector, for that warm introduction. I know this is avant-garde, and it is so exciting to know about pet acupuncture. So just a little bit of a side note, I will be monitoring the chat box or chat board, just in case if there are any questions or any comments. I will go ahead and read that out later on. So please feel free to interact. So without further ado, I would like to introduce Fred Wolfson. He is an American acupuncturist, and Fred is going to tell you about himself, his career with people and pets. So I welcome Fred.
Okay. Hello, everyone. Very, very happy to be here with you all. Now I'm using my Zoom with my phone here, so I'm assuming that my image is okay. Does it work okay?
Yeah, you're okay.
Yes, you're receiving in quite well.
Okay. All right. Very good. So I just want to say that it's fine to ask questions while I'm talking. If the moderator of the chat or the moderator of Zoom tonight can just interrupt me and let me know somebody has a question, or I think we're set up so that anybody can just sort of unmute and raise a question. Is that correct?
Absolutely.
Okay, so that's fine. No need to wait till the end. In fact, I think sometimes it's better to have a dialogue at different times here. So we've got let me see, we've got almost 45 people. Now I'm making an assumption that most of the people here tonight are either acupuncturists, certified acupuncturists, or acupuncture students. So if there are people who don't have any real acupuncture background and may be lost at certain parts of this talk, or have some questions they may not want to share right now, I'll stick around afterwards when we're done, and you can ask questions, or you can email me or chat on Messenger later on. All right. So I'm going to start with just a little bit about my background. I went to school in the U.S. in the 1980s, the mid 1980s, to acupuncture school after college. And back then was still very, very new. Acupuncture was still relatively new in the U.S., and most states didn't have laws yet to govern acupuncture. So it was kind of a strange time. People could get arrested for practicing acupuncture without a medical license back then in many states, and many people did. So I went for a year, and I loved it. I knew that's what I wanted to do, but I thought it was better to wait until the field matured a little bit. So I went and got a master's degree in rehabilitation counseling, which is working with people with disabilities. So I worked as a government-appointed advocate for people with disabilities for about 10, 11 years after that first year of acupuncture school. And then I realized the field had matured quite a bit. There was a lot of laws in place in most states. So I went back to school, and then I finished in, that was 2004. And then and then in 2006, I started the animal training. So that's how you, in the US, that's how you have to do it. You have to complete your people training first, which is anywhere from, in the US, 3,000 to 4,000 hours, and then 3 to 4 years. And then you can take the animal training, which is about 5 months. Mine was 187 hours. And it was very, very fun. You know, in acupuncture school, there's a certain amount of pressure to learn, and you have to, you know, to pass your boards. And so although acupuncture school was fun, it had the added element of pressure to it, whereas the animal training was just pure fun, you know, and everybody there was, you know, of course, crazy about dogs and cats, and so it was a really fun environment. And in addition to training on dogs and cats, there was a component that involved horses, because one of the founders of this program really pioneered horse treatment. And she wrote a book that's very well known. And actually, so I don't forget later, the name of that book is Animals in Their Element. And it's a great read if you enjoy reading about 5-element theory. And she applies it to animals and through and it's not technical, it's through her own anecdotes, and really well written. And you learn a lot about applying 5-element in your practice to both people and pets. So I highly recommend that book if you're looking to learn more. That's called Animals in Their Element, by Siri Barnes, Barnes. So that was horses. There was a small component practicing on rabbits, ferrets, and birds. Birds was it, which so, and we if we have time later, we can talk about that. But it's mainly, the main focus was on cats and dogs, and we did a lot more training on dogs naturally. So that was in 2006. And then, so I finished that program, and I started, like most of my classmates, working on a small number of animals, building my animal practice. I already had a people practice. So I expected that my animal practice was just going to be a small part of what I was doing. But then I got a call from some rescue agencies that had gotten involved with a court case, a famous court case in the US. There was one of the most well-known athletes at the time, a football player. He had organized illegal dogfighting in a very big way. He had a large dogfighting activity, and was raising many dogs to do this. And he got caught, and what's that?
Huh?
Kindly mute your mic.
Can you still hear me?
Yeah.
Yes, we can hear you, sir.
It's okay.
Oo.
Well, I think your mic is on.
Yeah.
Si Arte.
Can you please mute your mic? Thank you.
There you go. So he got caught, and the judge, normally with dogfighting, historically the dogs have been put down, you know, have been killed if they were known to be involved in dogfighting, because they thought they couldn't be rehabilitated. But in this case, the judge really, there was so many dogs, it was involved, that the judge wanted to try to rehabilitate those that could be. And so he fined the sports player $1 million to go just towards treatment for the dogs. And so this rehabilitation agency got some of the money. They contacted me. At that time I was the only animal acupuncturist in the city. And they contacted me and asked if I would try working with some of the dogs. And the first dog I worked with had a lot of health issues, malnourished and very bad anxiety. And the treatment went really well. And at about that time, the Washington Post, which is a very large newspaper nearby where I was living, they heard about these the different kinds of therapies like acupuncture that was being done with the dogs, and they wanted to do a story about how the dogs were doing a year after being rescued from the dog fighting. And so another dog was referred to me, and the Washington Post wanted to come out and film the first session with this dog. And this is a caution. I'm telling this because this is a cautionary tale, meaning this is what not to do. I said yes without thinking. I thought, sure, you can come and watch my first session, not knowing how it would go, whether it would be a very difficult session or a dangerous session, or and so they came and filmed. They brought a film crew, and fortunately, I got lucky. The dog, although it was very anxious, I had to crawl under the desk to treat the dog, whose name was Sweet Pea, and the dog didn't bite me, and the treatment went well, but it could have gone very, very badly, and it's not the kind of thing you want to be on film. But out of that experience, they wrote an article about myself and some other practitioners of different modalities that were working with the dogs, and it landed on the front page of the newspaper. And so after that, overnight my animal practice kind of exploded, and I had more animals than I could possibly treat. And so that's how it went from there. The animal practice just really grew and grew, and so that was 2007, 7, and 8. And I kind of wanted to just start with a lot of people have asked me questions here, like what are treatments like people kind of want a sense of what's it like from start to finish. So I was happy. I didn't know we were going to show the videos tonight, so you could get to see a little bit about what it looks like. I'm not sure if that was an acupuncturist treating in those videos or a vet. So I'm going to take you through a typical session, and just stop me if you have questions. I'm not going to go into great detail, just for time's sake. But I'll try to give you enough detail so you have a sense of what a session looks like. So so your owner calls you, and they'll, you ask them what the main issue is, and let's see, we'll make up something here. Let's say the issue is a urinary a urinary issue. The dog, let's say you have a 6-year-old Labrador, a Labrador Retriever, and they're suddenly started losing bowel control in the house, and I'm sorry, bladder control in the house, and the owner doesn't know why. And so they're calling you, and the first question that we always ask as acupuncturists is, have they been seen by a vet? Because you want to know if there's already a Western diagnosis. So the owner tells us that the dog has been seen by a vet, and the vet, through blood tests, urine tests, through palpation, and some other exams, that they ruled out the most obvious things: a urinary tract infection. They ruled out diabetes, and or a tumor. So the vet's not sure what to do at this point, other than medications. So the owner's calling you. They want to try acupuncture before they put the dog on a lot of medications. And so the next question you ask, you want to find out if how the dog does with the vet. Are they particularly fearful? Are they particularly anxious or even aggressive? And the owner assures they're very easygoing. It's a very mellow dog, and plus you have the information already. This is an older Labrador, and most old labs, I mean, this is a generalization, make the best patients. They're extremely good with the needles, and they're happy to just lay in your office all day if they're getting petted. So they tend to make the ideal patient. So you've already gotten that piece of information even before they walk into your office. So for those of you who think in 5-element terms, you can think about this is the earth. This lab is the earth personality. It's not a dominant dog. It's a very mellow dog, easygoing, and as an earth personality, the issues tend to be, I mean, and again, this is a generalization, but for a dog, they might have GI issues. If there's an earth imbalance, they might have weight gain. Those are two common things you might see. So at that point, you would give instructions what you want them to do before they come to the session, what you want them to bring in terms of a collar and leash, how to get the dog ready before they bring them. So you go over those instructions, and so when they show up, you have the owners fill out your paperwork, and the paperwork will look very different than your people paperwork. In general, it'll be much shorter, and you'll, in addition to the normal kinds of history that you'll want, my paperwork includes a place for you want to know if their thirst is normal, if their appetite is normal, if their bowel movements are normal, those kind of things. Maybe in terms of hot and cold, getting a sense of where some imbalances may be. But the paperwork is pretty short, because most of that you're gonna do when you do the intake and sit down with the owner. So while they're filling out the paperwork, you're watching the dog carefully. You want to see how the dog is doing in this new environment. You've just brought them into a new environment, and you don't know if they've been in the car for an hour in a hot car. Are they really hot? Are they irritable? Do they need to go to the bathroom? Have they been walked? Is it a dog that's generally very anxious with new situations, new people, or mellow? So you want to see how they're adapting to the room. You've got new smells in the room, a new person to get used to. So you really want to observe the dog, and I'll say this over and over again, is for those of you who plan to do the more extended training, the most important thing is keeping this a pleasant, positive experience for the dog, a non-stressful experience. And so because when they come back, you want them to have a positive association with you and with your space and with the treatment itself. That's the most important thing that would come back to over and again. It's sort of our prime directive. So we'll talk. You'll, depending on what the condition is, you'll gear your questions towards clarifying your diagnosis. So your intake's going to be different for each pet, just like it is for each person. And that also, the intake is a time for the dog to sniff around, to relax, and get to know you. Is the more that you can pet the dog while you're doing the intake, the better, if they'll allow it, if the dog is comfortable. And so, after that, you've gotten a sense of what you want to do in terms of a treatment strategy. And that will, of course, depend on your particular training and how you put together a diagnosis. I mean, all of us, I'm assuming we've got now 60 people. So that's, people are practicing in all different ways, and all different styles of acupuncture. And so that's actually, for me, part of the fun of the training when I did my training, is learning from other students how they're putting a treatment together. Because a lot of the students I went to, that I did training with, went to a 5-element school. I did not go to a 5-element school. Many of them went to a school that taught exclusively 5-element, the Worsley School. And so I got to learn that way of treating and putting together a diagnosis. So once you've got that done, then you'll move to the floor. Unless for some reason you need to treat on a table, but the floor is the best place if you can do it, and if the owners can do it. It means everybody getting down on their knees for a half an hour or 10 minutes to a half an hour. And so you would show the owner how you want them to position the dog, because they should be the ones to position the dog. It will be less stressful. And you teach them how you want them to hold the dog and why. And you explain where you're going to be and what you're going to do. It's helpful to find out, when you're doing the intake, to find out if the owners have ever had acupuncture, because that makes it much easier. If the owners have a sense of what acupuncture treatment is like, it makes your job a whole lot easier. If they have no clue and they, this is the first time they've seen a needle, you're going to have to do a lot more explaining even before you get down on the floor. So you'll position the dog, and you've explained what you're going to do and why, and then you begin to put your needles in, and the most important thing becomes assuming the dog can relax. And we've got a Labrador, so most likely they're going to be able to relax, and you're going to be able to position them okay. That may be laying down on their side. It may be laying down, but not on either side, just in a lying position. It may be half sitting position, you can treat, or it may be standing position, which is not ideal. Some dogs just won't go down. They're too anxious. And that's okay. You can still treat if the dog is standing. So it just requires, the first session just requires a lot of flexibility. You don't know what's going to happen. You don't know your owner either, and how good they're going to be at holding the dog. Not every owner will follow your instructions. Not every owner is very good at asserting themselves with their pet. So it's a lot of observing and training and retraining, getting everybody used to the procedure. And then once your needles have gone in, assuming that went well, that there was no big reaction to the needles, and usually there isn't. If your needling technique is good and your point location is good, generally the dogs feel the needles less than people. Cats are a different story, but we're gonna focus on dogs. And then you have to see, you've got your owner at the head, and they've got control of the dog's head, because not that this Labrador is going to bite me or bite the owner, because that would be very unusual for a lab. But if a needle itches, if a needle bothers them during the treatment, they can whip around and grab a needle in their mouth. And that's the biggest danger. That's why you want the owner to be vigilant and hold the dog's head and have control over the dog at all times. And so then you see how the dog does with the needles in. Are they relaxing? Does it look like the dog can go 10 minutes, 15 minutes with no problem? And you're just watching. You've got usually one hand, if the dog is laying down on the side, you've got one hand, like you could see on the video, maybe one hand on the dog's hind legs, and just in case they go to hop up quickly, because dogs don't give you any warning if they're going to hop up. Or the other thing, if they try to, let's say you've got 8 back shoe points in, and the dog is laying on its side, you don't want the dog to roll over on the needles, which also can happen very quickly, especially if the dog gets itchy on those spots. So you've got a hand on the hind end. The owner has control of the head, and the owner is talking to the dog and keeping the dog's attention, and praising the dog, whatever relaxes the dog, really. I try not to use treats unless I absolutely have to, because treats can be great and they also can be awful. They can really make the dog too excited, too distracted. So then we just we hang out with the dog while they're relaxing, and often the dogs will relax. Some of them will fall asleep for a short while, just like people. Some of them will go into kind of a meditative state. And the first time, like I said, is just an experiment to see how it goes, how long they'll go, and then you cue in when they start to get fidgety. You don't wait until they get stressed out. You take the needles out immediately. So your treatment may be, I've had treatments that only went 3 or 4 minutes, and then I've for some dogs I've left the needles in as long as a half an hour, 35 minutes or more. And then you're done. And at some point during the during the session, you preferably before, just discuss your treatment plan with them, and what you feel like will give us the best possible results. And so often you want to make sure that the owners are willing to commit to at least 3 treatments, especially for any kind of musculoskeletal issue, which will be the vast majority of what you'll see are going to be musculoskeletal issues, neurological issues, paralysis, those kind of things, arthritis, older dogs who have a muscle injury, a joint pain, joint injury. That will be the vast majority of what you'll encounter in your practice. So let me stop there for a minute. I just want to look at the time. Any questions on that part before I go on to the other parts?
I have one for you, Fred.
Okay.
Remember, we were discussing this before that, the sedation point would it be, part of the treatment that you sedate do the sedation point on a dog, just like the yin tongue, before you proceed with other treatments?
Yeah, that can be a really helpful strategy. Do 20 and yin tongue to
Mhm.
start off with.
Okay.
The exceptions would be if the dog is not comfortable with you coming around their head initially, you might want to hold off on that. But generally, if you've done all the other steps correctly, you
Mhm.
can quickly put those points are so easy to put in, and the dog, if you do it right, the dog doesn't even know that you're putting them in. They just feel like you're petting the top of your head.
Mhm.
If you're using one hand to pet and one hand to put in the needle, those 2 needles, you can do it so fast. So yeah, that's a good point. It's
Okay. Thank you. Thank you.
often that's off the way to go, especially with smaller dogs that really need that calming before you start with the other points. The smaller the dog, the more challenging the patient in general. I mean, it's a generalization, but I found it to be pretty true. Any other questions on what the treatment looks like? I'm trying to give just a basic outline without getting into too much, treatment detail, treatment strategy detail.
I have a hand raised from Julius.
Hello, sir. Yeah, can
Hi,
you hear?
Julius. Yes.
Hi. So I have a question because based on what you were discussing a while ago, it seems to me that the diagnosing part is much harder compared to in diagnosing human beings because when you're treating people, you can do tongue diagnosis, you can do pus diagnosis, you could do other diagnosis, which I think you cannot really do with your pets. So aside from the observation, aside from the behavior, so what other tools of diagnosis that you can use for for animals?
Good question. Well, you do learn tongue diagnosis in the training. And we do use the tongue just like with people. Most of that information that you've learned in school about the tongue applies um, to dogs with some modifications, which you'll learn. But most of what you've learned will be very useful with dogs. And with pulse, a little bit different. That's a little bit different. You also learn to take the pulse of a dog. In this case, you're using the femoral pulse on the back legs, the inside of the dog's hind legs. And so you would get training in that, and that can be useful too. But you will get you'll get most of your information from the intake, from what what questions you choose to ask the owner, and you want to get during that intake, you'll try to get a sense especially in this case, in this scenario that I brought up, where the issue is the incontinence, for a middle-aged dog, you would need to ask, questions that get at some of the constitutional factors of that dog, like, do they prefer warm spaces in the house or cold spaces, hard surfaces, or do they rest on they seek out cushiony surfaces, soft surfaces. You'll modify your 8 principal questions. You'll learn to modify the 8 principal questions that in a way that relate to a dog's life and a dog's constitution. But still, all those 8 principles, if that's what you've been trained in, and that all those factors will still be very relevant for a cat, dog, horse. So you'll and part of that is practice, is learning how to do your intake so that it's not an hour-long intake, because you can't keep that pet, in a lot of cases, in your room for an hour while you're asking all the same questions that you might ask a person. You've got to streamline it somewhat. So you learn to do that. Did that answer your question?
Yes, sorry, and it's really good to know that we can also do pus and tongue diagnosis with dogs and animals, as well as other types of diagnosis. So
Yeah.
maybe
And
my last question is,
sorry,
sorry.
Julius. I left out, things like palpation become very important too.
Oh, yeah.
And that's something we emphasize in the training, is how to palpate the dog to get in, because you can get so much information from palpating, and feeling the heat levels, on different parts of the spine, or the heat levels in the 3 jowls on the underside of the dog, and just learning. The dogs will come in with all kinds of musculoskeletal, neurological issues, and you want to know how sensitive they are to palpation, how tolerant they are for you to touch them, and how reactive. And the owners may tell you one thing when you ask them how sensitive the dog is, but you may find something very different, because the dog allows them to palpate in a different way, because they have a whole different level of trust with the owner. So palpation comes into play a lot. I'm
Okay.
sorry, you had another question?
Yeah. So maybe my last question is, from a bird's eye point of view, what do you think is the main challenge in treating animals compared to people, or can you say, is it easier, or which is much easier to treat? Is it people, or is it animals?
Well, animal treatment can be very exciting, because you often get much quicker results with the pets. You often see more dramatic changes right in the session, or with much fewer sessions. Especially when it comes to neurological deficits, with dogs that have some level of paralysis, or issues, limps and things. They just tend to respond much quicker. Their chi is not, in general, unless you have a really old dog or an old cat that comes in, their chi has not been, nearly as stagnant as an older person's, may be. Same with blood stagnation. Because of that, they respond quicker, and also they don't have all the emotional issues around their illness. They're not staying up nights worrying whether their whether their back is going to get better or not. So they don't have all the whole emotional component affecting their chi. So for all those reasons and more, you see things that I mean, every month treating animals, I would see a couple things that just kind of blew me away. Even after years and years of treating, I would just be surprised by the power of acupuncture, and that in turn keeps you excited about acupuncture. Just seeing that, it keeps you excited about treating pets and about treating people, because you really see how what an incredible modality it is. I hope that answered your question.
Yes, that really made me very excited. It
Yeah.
is training.
Yeah,
Yeah, I
it's
guess
very
it's
fun.
really
I mean,
more
if you're an
fun treating
animal
animals.
lover, it's very fun. And there's an element, you never know, you never know what's going to happen. And after I've been treating people for 20 years, and you do get some surprises. But with animals, you really never know what you're gonna get each session. It's really always new, always different. And I like that. There's to me, that's really fun.
Thank you, Doc. Thank you.
Yeah, sure.
Well, thank you for that question, and thank you, Fred, for giving us a detailed approach to it. I have another question that has been raised here from Maria Wilma. It says, "How do we know our pets have fever? Do they have high temperature also? Is the diagnosis the same as humans?"
Did you say fever?
Yes.
Yeah. Well, a vet can take the fever. We can't. I mean, they can take a temperature rectally, unless that's changed. I think that's still how they do it for dogs. At least with the vet I used for my dogs, that's how I always saw it. Maybe um, there's some new method I don't know about. But in
Looks
this
like,
case, and that's a good question, because in the scenario that I brought up with this Labrador, you would already have that information from the vet because the vet definitely would have taken, with that kind of incontinence issue, they definitely would have taken not just the blood test, but also temperature. Yeah.
so I would like to, just reiterate what you said earlier on the intake, to ask the pet owner if they have a veterinarian, because as we know, we complement what we do with just as like with humans, we complement what the physician has for us. Thank you so
Yeah.
much, Fred. There's
Let,
another
let me just
question. I'm sorry, go
let me
ahead.
just tack on something, because I should have said this in the very beginning, because it's really, you're making the most important point, is that this is the acupuncture is a complement to, and I'm speaking as an American acupuncturist for a moment, because we were there were acupuncturists who worked very hard to get agreements with the veterinarians in the U.S. To be able to treat in the way that I was able to treat. So that took a lot of negotiation with the veterinarians, because as you can imagine, there were some vets in the U.S. who felt that any animal treatment should only be in the domain of veterinary medicine done by a vet. So right now, I happen to be in a state that at that time, this was again back in 2007, there were only 2 or 3 states that had worked out laws with the veterinarians in order to be able to treat, as an acupuncturist in my office and not in the veterinarian's office. Now I understand there's at least maybe 13 to 15 states that have worked out agreements. Each agreement is different in each state as to how they're able to practice, how much supervision they need, if any. In my case, it was required that the animal would be seen by the vet within the previous couple of weeks before I saw them. In other words, you wouldn't have you wouldn't have see an animal like this Labrador who with a urinary issue that had never been seen or given a diagnosis by the vet. So that would be unethical. You would have to, if that was the case and the owner called, you would have to insist that they get a vet checkup and see and testing before, so you could treat them, and that goes for most issues, you know.
And
Um,
I see how this is so avant-garde here in the Philippines, because we actually don't have the laws yet that protect that involve around acupuncture with animals or pets. So it's groundbreaking. So it's something that needs to be thought about.
yeah,
I have
yeah.
another question here. Um, from Irene. Uh, is there a specific size or gauge of needle to be used for animals?
Um, Generally, you're going to be, for um, areas where there's not a lot of muscle tissue, you use a half-inch needle, preferably one with a plastic colored handle
Hmm.
if you can get them, because that makes things a little bit easier when you're learning. After you've learned, you can use, whatever needle you'll adapt, but it does make it easier with a colored handle. It's amazing how easily the needles are lost in the fur, with a silver needle. Um, and yeah, so you'll use, and then for all the other points, you'll use a 1 inch needle. I never used a 1.5 or 2 inch needle. I don't think my colleagues were using them either. Um, and then in terms of gauges, that gets into a long conversation about your particular style. But I tended to use a thinner gauge needle, but not all my colleagues did. And it depended on the animal too, the size of the animal. It's different working on a Yorkie or a Chihuahua versus a Great Dane or a Mastiff or a Rottweiler or something. Yeah,
Well,
but always
thank you for
easier to learn with a thinner, always easier and safer to learn with a thin needle.
yeah. You raised a good
Yeah,
point there, because with the fur and with the colored tip, not colored tip, but colored handled needles, they'll be easier to spot if in case So yeah, it's a great point. I don't see
yeah.
any.
Imagine you've got 20 needles in a dog, and suddenly they hop up and they shake, which dogs will do. And now you've got 20 needles all over the room, and you've got to find them. So that's something to consider to how you set up your room.
Yeah. So it's
Very,
also
very easy
important.
to,
Yeah,
and
it's also
dogs will
important to
wiggle.
know. Yeah, I'm sorry. Go ahead. It's also
Yeah,
important to
yeah.
know
I mean,
the number of needles you used.
absolutely. It's essential, right? Right. You got to count your needles, before and after, and because they'll wiggle. Your patients may wiggle, but the dogs will really wiggle, and some of your needles are going to fall out, and they'll you really have to keep track of them.
Okay.
I have a
You
lot
know,
of and when we do the full training, I have a lot of, um, you know, over the years, I made a lot of mistakes. I hope I can communicate them so you all don't have to make those mistakes. But yeah, that's an element, a challenging element. I think Julius was asking about challenges, that needle management and safety management is at a whole different level with animals than you don't have to worry about with people. I've been fortunate. I've never gotten bit. I never really even had a close call with a pet, and I think and most of my colleagues the same. Maybe I did have a colleague who had a close call with a cat. But if you if you follow all the safety procedures, you will also have that same experience. You won't have to worry so much about bites. So
So
I think a question just flashed up on the screen and I missed
yes,
it.
it just says that do you use ear seeds on dogs? And I think that would be a
I
challenge
never
because of the
have.
fur.
I never have. I don't know. It wasn't part of our training. I don't know if other acupuncturists do.
Uh, and it might also be a
Oh, and
challenge
just
because of the fur.
right,
Mhm.
right. I'm not sure how that would work. I'd have to give that some thought. It never, yeah. I mean, some dogs do have an ear that doesn't have a whole lot of fur
Uh-huh.
inside, so maybe it's not, maybe it's possible. And just Ryan, just to go back um to an earlier topic,
Uh-huh.
um, veterinarians in the U.S. when they do acupuncture training, their training program I think is between 150 and 180 hours. So the way they practice, the way they diagnose, the way they do everything is very different from how we put together a treatment strategy and choose points.
Mhm.
As you can imagine, try imagining learning all of acupuncture in 150 hours. Um, it's and you'll get a sense of the limitations there. Um, not that they're not effective. It's just going to be a whole different way of treating than we do. Yeah.
Um, I I don't see any other questions in the chat box, and just go ahead in
Okay.
the interest of time. Go ahead.
I did earlier in the week. Someone had asked me a question. I'm gonna answer it now because this is just I'm gonna list the major areas that a complete training would include generally. Because that just hearing it may spark some additional questions. So in a full training, no matter how many hours that training may be, and by the way, we're not sure yet how, when we do offer a full training here, how many hours it would be. But it would have to include the elements I'm going to list here. So the first obviously would be anatomy and physiology of your dog and cat, and then canine and cat diseases, health issues, and with that would be zoonotic diseases. And zoonotic diseases are those that can be transferred from your dog to you or you to your dog, back and forth. So, and I'm listing those first because in my training, we were very lucky. We had a veterinarian teach those sections to us, and he was one of the few veterinarians in the world who had also gone through a whole acupuncture training. So he had gone through a 4,000-hour acupuncture training instead of the 150 hours. Plus, he was an experienced vet. So he was just the perfect one to teach those things. But when we offer this course, we will also bring in a vet because a vet is much more qualified than I am to teach about the most common diseases that you'll see here in the Philippines, especially because the most common diseases here are somewhat different than the ones that I might ordinarily see in the US. So same thing with the zoonotic diseases are going to be a little bit different. And in terms of anatomy and physiology, they're much more qualified to answer in-depth questions than I am. So that would be the first part. Then we would learn about different breeds, which is, for those of us who are dog lovers, that's really fun to learn the different breeds and the different temperaments, and again, relating those breeds and the temperaments back to what we already know about 5-element theory and 5-element personalities, and relating to the breeds with, is this tend to be a fire personality or a wood personality, and I enjoyed that part of the training. Of course, you have your point location, and learning to use the point charts that are available, and point location is straightforward, but it also gets it requires a lot of hands-on, because finding stomach 36 on a Yorkie is completely different than finding it on this Labrador or on a Greyhound. There's obviously a lot of variations that you don't have that much variation with people as you do with dogs. So that's a lot of hands-on. The diagnosis and the tongue and pulse we already talked about. Treatment strategies we talked about. That's going to be again a time in the training that we really are all learning from each other. I have a particular way that I treat based on what I'm comfortable with, but by no means is that the only way to get effective results with dogs. There are many ways to get to put together effective treatment. So sharing different ideas and treatment strategies is really a big part of the training, and especially considering a lot of dogs you're not going to be able to needle the points that you would like to needle on the paws, or in some cases the head or the lower part of the limbs, and so you've got to get more creative with dogs. You have to really be creative and have different treatment strategies, and because of that you really grow as a practitioner, because you can't just you can't rely on the things that you maybe rely on in your people clinic. So that's really a great part of the treatment, is you'll expand as a practitioner in that way. Safety handling skills, we already touched on that. There's a lot of training about keeping yourself safe, keeping the owner safe, keeping your dog's patient safe. When there's training on when to refer to the vet, when not to treat, the kinds of issues that you would want to check in with the vet before you treat, and that's a great way of learning more about pet acupuncture. Is you have these conversations with the vet, if you have questions, and you learn over time. Let's see. The other pieces, there would be a piece about communicating, how to communicate with owners. Like I talked about screening, when we first started screening on the phone before they ever bring the pet in, to make sure they're going to be a good candidate for acupuncture, and everyone's going to be safe. That requires effective screening, at that first conversation, if you can. And how to talk to vets, because vets want to talk, when they talk acupuncture, they want to talk Western medicine, with Western medicine language, and when they talk about acupuncture effectiveness, they want to talk about neurotransmitters and endorphins, and it's helpful if you can talk knowledgeably in their world, in that kind of research. And the Western medicine research on acupuncture is so available now. It's easy to learn and have some basic knowledge of when they ask you about acupuncture and its effectiveness and the research behind it, you could have some fast go-to answers and research to give them. And then the final thing is really death and dying issues. A lot of the dogs you'll end up seeing, you're seeing them at the end of their life, the last 3 months, 6 months, last year of their life, and you get very attached to the dogs, and you get to know the owners really well, and you'll end up losing, seeing a lot of dogs pass, and just talking about how to deal with those death and dying issues in our training was really helpful to me anyway. So anyway, those are the areas that a training would include. Any questions about that before I go on?
I went ahead and listed a summary of what you said.
Oh,
and
thank you.
posted it in the chat.
That's great. Any questions?
I
All
have
right.
one question here from let me see, from Julius, about sharing one of your biggest success treatments from experience, and what type of animal and what type of illness.
I mean, I shared one of the most memorable, which was that pit bull that all the dogs that I treated from that dog fighting incident were some of the most memorable, because I knew that if they couldn't be rehabilitated and integrate back into a family or some type of safe environment, I knew what was going to happen to them. And so those were some of the most fulfilling successes, just seeing a dog who was so abused and so traumatized and so anxious, really transform, and in some cases could go with the family, and live out their lives with the family. Not all of them. Some got sent to a 1,000-acre ranch out west to live out their lives, but some were able to integrate. And so I would say that was some of the most fulfilling for me.
And thank you so much, Fred, for sharing that. I would like to entertain one more question from Albert, and it says, how will you use the cun measurement in dogs and cats?
You're still using the same ratios. It's all about you're talking about measuring on the limbs and to find the points.
Yes, I
Yeah.
believe that's what he was referring to.
Yeah, I mean, the ratios will remain the same. And so you're just divided. If it's a Chihuahua leg, your soon measurements are going to be the same, but of course the ratio would be much smaller than the leg of a Great Dane.
Mhm.
That said, I rely a lot on palpation too, in terms of locating the points. But I came from a massage therapy background before acupuncture, and so I just naturally use a lot of palpation. That's going to be a personal preference, how much you rely on that versus other ways of measuring or finding point location. But the most important thing is just practice, getting to palpate and find the points on as many dogs as you can while you're being observed by someone who can confirm, yes, that's gallbladder 34. No, it's a little bit in this direction or a little bit in that direction. Just just having that experience of getting your hands on a bunch of different dogs and having the points confirmed, there's no substitute for that.
I hope that answered the question.
Albert, did that answer? Yes. Okay. Well, if it doesn't come back later, and well, I'll see if I can give more information. I want to give while I'm thinking of it, just two studies. I mean, there's a lot of good research on the internet that have been done with animals and acupuncture. I want to give just two that I think are interesting. The first study was done on a large number of dogs with neurological deficits, all different kinds of neurological deficits, and probably some paralysis, spinal damage of different degrees. And these were dogs with grade 4 neurological deficits, so relatively moderate to severe. So in this study, they found that surgery alone, treating these dogs, gave a 40% success rate. Electroacupuncture alone gave. Before I do that, let me say surgery and electroacupuncture gave a 72% success rate. But the interesting thing, electroacupuncture alone gave the best, which was 78%. So that was interesting. The electroacupuncture alone proved better than most of the surgery combined with electroacupuncture. The other study was on dogs with lymphoma. Actually, this was done with dogs and cats. And the results were with the ones that received acupuncture alone survived 6 to 12 months for dogs, 12 months for cats on average. This is just acupuncture alone. And then the ones on taking chemotherapy alone survived 9 to 13 months in this study. But the ones that had acupuncture had significantly better quality of life, as you can imagine, than the dogs who were receiving chemotherapy. Much, much better quality of life, with almost the same amount of survival time, up to a year. But the ones that had chemotherapy and acupuncture, they tended to survive 2 to 4 years. So I think this is a really important study and shows you the power of acupuncture with pets. There's more, but I don't want to bore you with a whole lot of studies. You can look them up, and they're really interesting to read. So that was let's see, it's 10 after 8. I want to leave plenty of time for any other questions. That was really the main points I wanted to talk about. Let's just open it up, see if anybody has anything they want to know
one
about.
for you, Fred. I think it's from Maria Wilma. She's asking how many acupuncture points animals have.
All the same as you and me for dogs.
For dogs.
For dogs. Now, when you get into horses, and by the way, I didn't mention this, but in the U.S., I was not acupuncturists are not allowed to use well, we can't treat farm animals. So any kind of, it has to be a what they consider a companion animal. So horses were considered a companion animal, but not pigs, goats, sheep, or cows. And the anatomy of a horse, pig, sheep, goat, cow is very different than the anatomy of a dog. They're not, in other words, they're not like big dogs. The anatomy of the legs, especially, is very different. A horse's legs have completely different structures than a dog's legs, which I didn't know before I took the training. Um, and so the points are different. There's variations, but if we're talking about just dogs and cats, um, same basic points. Also, I should say we in the U.S. we were not allowed to give herbs to pets, prescribe herbs, or make dietary recommendations, and which is unfortunate because there's not a lot of vets who really know Chinese herbs in the U.S. I mean, there are some. We had, I and my city is pretty big, but even so, we only had maybe two veterinarians who could really prescribe Chinese herbs well for pets, maybe even one. Um, and they certainly didn't have the same kind of Asian nutrition um, knowledge, Asian nutrition principles to prescribe for the dogs. So you won't have that hindrance here
Okay.
in
I
the
have two more
Philippines because
questions
there
here.
are those
Okay.
restrictions.
I have two more questions here. One from Krishna. Regarding dying transitions, will their pulse or tongue have patterns that that would tell you they are already likely at the end of their life?
Um, Boy, that's a good question.
Yeah.
Um, we would know it. I didn't know it so much from pulse and tongue, no, and I wouldn't. I mean, it became clear over time, just by knowing the dog and seeing, their overall level of chi and the way they were responding in treatment, and by what the owners tell you about their affect at home, their behavior, their appetite, all the things that would give you clues that the dog was in decline, and those things gave me more information. And usually the owners that were um, the owners in the U.S. that bring their dogs for acupuncture are not your typical owner. They're not your average owner. They're very in tune with their dog. They're very committed to their dog, and if and so they just know. They know when the end is coming, and they've had conversations with their veterinarian. Over the months that you're treating, they're talking to their veterinarian, and the veterinarian is preparing them for you know for in some cases euthanasia. So they know.
All right. Well, thank you so much. One last question that we're going to entertain. It says, how would you differentiate acupuncture treatment with cats from dogs?
um Cats are, you have to screen, on the phone. If you can, screen on the phone before, a little more carefully, make sure they're going to be a good patient. And occasionally you'll get a cat in the office who you don't feel comfortable treating. You're not sure if it's going to be safe for you, for the owner. So there's more likelihood that they might get into the treatment room and you might have to turn them away. That happened to me a few times, not a lot, but a few times. And you're going to leave the needles in generally a shorter time with cats because they're not going to tolerate having the needles in. Um, there's more differences, but those are the things that you would notice right away.
Mhm.
And often there's not as much muscle tissue on the cats, and so needling requires a little more, the palpation to find the points, because the cats are not necessarily going to love you palpating. So your palpation techniques are going to be a little bit different. and needling technique is going to vary a little bit because you're not, there may not be a lot of muscle tissue, especially with older cats, that are very frail and thin.
Thank you so much, Fred.
Yeah.
And going back to what you have said earlier, having treatment with dogs have more, because of their temperament and with the owners being there and being able to control them, would be a much easier route.
Yeah, sometimes you're treating cats in their cat carrier because they
Uh-huh.
feel safe there. And so that requires skill your getting down into the cat carrier to put the needles in, and that happens quite a bit.
Okay,
Yeah.
thank you. I'm going to turn this over to Dr. Hector.
Yeah, okay. We would like to acknowledge the presence of some veterinary physicians. Sir Albert, do you know who they are?
Yeah, one of them are Dr. Arger Dubalia.
Good
Hi,
evening,
Doc. Thank
doctor.
you for attending.
Mhm. So, how do you see uh, the future of veterinary or pet acupuncture? Like, what is the conflict between a veterinarian practicing acupuncture and someone who is not a veterinarian but is an acupuncturist? Do we see any issue? Like, how do we, if ever there is an issue, how are we going to reconcile the conflicting, if ever there is a conflict?
Um, are you asking me or the veterinarians in
We're asking you.
the group?
Yeah,
Oh,
because
okay.
yeah, and follow-up question is, how do you plan to conduct the training should in just in case anyone would be interested, and I'm sure there will be a lot of uh, the attendees here who might be interested. So we're talking about 150 hours. Like, do we do it? Of course, there has to be face-to-face sessions combined with, I think, mostly webinars.
Um, I think do we have a list of everybody who's participating, who's present today?
Yeah, Sir Albert, our marketing director, has the list.
Okay. So assuming that we have a way to contact
Mhm.
those people, and um, I think the best way to proceed is maybe uh, asking them what kind of training and how extensive a
Okay.
training they would be able and willing to commit to, considering that some of this has to be hands-on. Some of it can be done on Zoom, and some of it has to be hands-on, which would most likely, involve either me traveling or the participants traveling.
Mm.
So it would be good just to have some conversations with some of the participants and see what they're able and willing to do, and that will help us to gauge how many
Mhm.
hours is reasonable um, to create this training.
Okay.
I know it's not going to, like I said, my training was 187 hours. I know it's going to be a lot less than that, and probably less than 100, 150 hours.
Mm.
Um, and I think it can be shortened quite a bit. And part of that will depend on how many people we have signed up
Okay.
to end. Yeah, so I think the best thing is just since we have a list of participants we'll reach out to people and get some feedback.
So,
And
if it's not really going beyond, like, how much does it cost for one to learn pet acupuncture in the States?
I have no idea now. Things have changed a lot. My training was so many years ago. So I wouldn't know how to answer
Did
that
it cost a
question.
fortune
But
like, during your time 20 years ago?
um, no, it really wasn't. But in the U.S., acupuncture
Mm-mm.
education, just to give you an example, I told you that I had gone to school in the mid 80s.
Mhm.
If I had completed my whole education in the 80s, it would have cost me total everything for that would have been 3.5 years, or maybe 3,500 hours. It would have been $11,000,
Okay.
11,000 US dollars. Now, that same training now in
Yeah.
2023 is
Good.
$90,000,
Okay.
$95,000. So
That's a
that's
lot.
the US. So that's the only reference I have to go by.
So roughly, if one will have to uh, enroll in the pet,
That was my people. I'm talking speaking about my people training, by the way. But
okay,
yeah,
the people training,
yeah.
that's about
But that
90,000.
just shows you how much it
Yes.
shows you how much education has gone up in the U.S.
Yeah.
But here it's a whole, it's a whole different story, and I
Yes.
really can't speak to that here.
Okay. So maybe what
Yeah.
we should do right now is to form a community, maybe have another Zoom for those who are really serious about learning so that we can discuss it among ourselves. Would that, or do you have any suggestion, Sir Albert
Yeah.
or Dr. Ryan?
I agree with your suggestion just to get an feel. And I think to me, one session of questions and answers,
Yeah.
a second session would actually be excellent. By then, we would have assessed the idea if it has actually sunk in, or
Mm.
those that are interested could actually simply contact Sir Abbott.
Or they can email Fred directly.
Yeah,
Can you write your email address, Fred? So since
Yes,
you will
yes.
be
I'll put it in the chat
okay.
when I mute stop the video. I'll put it in the chat here for anybody
Okay.
that wants to
and
write me.
to chime
And
in, Google was telling me that there's actually a university at Chi University, and then there are three different tracks on veterinary acupuncture. There you have small animals, you have equine, and you have mixed practice. So that in itself tells you that it is, not only in general, but it also tells you that there are actually specifications or specializations. So
Yeah.
that is interesting.
yeah,
Very
veterinary acupuncture in the U.S. is very, very popular now. There's several international organizations that train vets around the world.
yeah.
And just Dr. Heckler, that just to go back to your question about veterinarians and acupuncturists, um, no, I don't think there's any conflict. I mean, I developed so many wonderful relationships with veterinarians, all around my state who referred, and we worked collaboratively. Um, and some of them were acupuncturists. I mean, were trained to do acupuncture themselves, but wanted me
Mhm.
to work on specific pets. And some of them did not have the training. But I see no conflict. I know a lot of veterinarians who went through the veterinary acupuncture training and then continued on to after their initial 150 hours. They loved it so much they continued to get
Mm.
additional training and additional knowledge and to learn more theory and more
Yeah.
philosophy behind the point prescriptions that they learn, and they're excellent, very effective practitioners. Um, so so no, if any of the veterinarians that are here today want to add to that, if you have experience, but that was my experience. I mean, I just have so many veterinarians that I learned so much from and really enjoyed working collaboratively with.
Okay. So maybe it's time that we collaborate with the veterinarians, right? We need to we need to strategically partner with them.
Absolutely.
Mm.
Absolutely. And like I said, I definitely want to, when we do the full training, I want to bring in veterinarians who can really add to the training.
Yeah. And I'm sure there are many patients that we have for acupuncture that are animal lovers as well. And this can actually tell you already what element they really show a lot. What element
Yeah.
characteristics they show a lot, especially for animal lovers. Okay. So are there any other questions? So that's it. Maybe we can have your email ad now once the
Okay. Okay. And I really, yeah, I just want to thank you all for attending. It's wonderful. We have so many people here tonight.
yes.
And I really do look, I hope that you will write me and
Mm,
and respond to our survey when we reach out to you so that we can get feedback about what kind of training that you want. And that'll really help us to design something that's useful for everybody.
do you have the email ad now? Fred Wolfson.
Yeah, I'll turn off my video and I'll write it on the chat.
Okay. So on behalf of LAMP, we would like to thank Sir Fred Wolfson for giving us a very inspiring introduction to pet acupuncture. And also our very active moderator, who is a pet lover himself. He has, I saw a lot of pets there. There was this mini pincher. What else are the breeds?
I have four fur babies, so
Yeah, so it shows. But anyway, so do we have the email ad now? So we would like to thank everyone for joining. And we hope that this can be the start of a very challenging, we love challenges, don't we? So we need to actually put in more effort in introducing something different so that everybody will fall in love with acupuncture. We hope to see a lot of people looking at acupuncture as a treatment modality that they cannot do without. They should be looking at this as a preventive treatment, not only seeing their acupuncturist when the problems arise. And we will not treat the humans, but their pets as well. So from LUMP, we would like to thank Fred Wolfson. Thank you very much for your time. Thank you everyone for joining, and of course our moderator. Thank you, Dr. Ryan.
you're welcome. My pleasure. And
So
the email
All right.
address is I repeated it a couple of times already in the
okay,
chat box, just in case.
thank you, and thank you everyone.
Thank
And
you, everybody.
hope to see you soon. Bye-bye. Thank you.